And what I'm here to talk about today is the Medicaid expansion. So for those non-health nerds that are in the audience, Medicaid is a government-run healthcare program that serves low-income parents and children, some folks on Medicare, as well as the disabled. Today, about 228,000 South Carolinians on Medicaid today, and depending on who you talk to, the expansion could bring about 330,000 plus more people onto the program. So how do we know who qualifies for Medicaid? Here are the major categories of Medicaid coverage. The federal government defines the word poverty by how much money you make, and that's called the Federal Poverty Level, or FPL. Here in South Carolina and in the lower 48, the federal poverty level is about $12,000 for an individual and about $23,000 for a family of four. So you can see that before any Medicaid expansion even takes place, Medicaid already covers kids, parents, and the disabled, and in some of those cases, they can earn up to 2 times the federal poverty level and still get coverage. So I mentioned that Obamacare is like a 3-legged stool, and the reason why I think it's a 3-legged stool is because the pieces are all designed to kind of work together, and Medicaid and the health insurance exchanges are no different. Here are all of the populations that Obamacare tries to cover. The light blue bar on the bottom shows what you need to earn in order to qualify for Medicaid coverage, and the dark blue bar at the top means that's how much you have to earn in order to get health insurance subsidies within the exchanges. We talk about Medicaid expansion, many folks say there's a gap population, and those are the small areas in white. What is the gap population? That means you're talking about people who make too much to qualify for Medicaid, but not enough to qualify for those subsidies in the exchanges. As you can see, when you talk about Medicaid expansion in South Carolina, there really aren't many gap populations when you talk about the traditional Medicaid recipient. You have a small gap with low-income parents making between 63 and 99% of the federal poverty level, and that's where Medicaid expansion is. But you can see that even before expansion, Medicaid covers kids, pregnant women, and the working disabled even more than what Obamacare requires. And when you see that dark blue bar fall below the red line, that means that South Carolina will be on the hook to pay for Medicaid for these folks when they could have gotten subsidies on the exchange. So when we talk about Medicaid expansion, who are the group that we're really talking about? The group that we're really talking about are non-disabled adults without children. As you know, there was a big Supreme Court decision last year, and one of the outcomes of that was that states now have the option to expand Medicaid up to 138% of the federal poverty level. Here is where we are today. So you can kind of read this map like a stoplight. Green means go toward expansion, and red means stop. 26 states, those are the states in green, have now accepted the Medicaid expansion or are leaning that way. 24 states, including South Carolina, have rejected the Medicaid expansion. And it's been interesting because you probably have seen a lot of publicity around Republican governors who have decided to expand Medicaid. Ms. Scorpions for Breakfast, Jan Brewer out in Arizona, decided to expand Medicaid, and John Kasich said he was on a mission from God. I didn't know God had Medicaid policy, but apparently he does, and he said that John Kasich had to expand Medicaid. But what we're also seeing is that a number of red states are also standing firm. Last week, Alaska Governor Sean Parnell rejected the Medicaid expansion. He called it, quote, a hot mess. And just last night at 5 o'clock, the New Hampshire special session on Medicaid expansion concluded without any expansion at all.